As a sports medicine pediatrician, why do you feel it's important for us to be thinking about the psychological aspects of injury and return to sport?
So it's no secret that the rates of depression and anxiety in children, adolescents, and young adults has been on the rise. The available data actually ranks suicide as among the top 3 causes of death in those age groups. I think sometimes there's this false perception that because we're also aware of the wonderful physical and psychological benefits of sport participation, that sometimes there's this false perception that athletes are somehow immune to mental health struggles. But there are some factors that are unique to the athletic population that we need to be aware of. Anyone who's around young athletes know that sports are a huge part of their identity in many cases. So when they have an injury and suddenly they can't play their sport for a period of time, it can be really devastating. Some estimates of post-injury depression are as high as 40% in young athletes after an injury. So it's really crucial for us to be picking up on these kids early, recognizing the ones that might be at higher risk, and getting them the support they need to better support their recovery. In some cases, that might mean referring to a pediatric psychologist like yourself, and I've seen firsthand how impactful that can be for our patients who see you through the Minds Matter Concussion Program. So as a pediatric psychologist who regularly sees young athletes after an injury, what are the most important things that you think we should know?
I think it's important to know that everyone who's working with young athletes in the aftermath of an injury can play a role in supporting their emotional health and well-being. And honestly, I think that's as simple as just starting the conversation about emotional health after injury. So whether you're a medical provider seeing a patient in clinic, whether you're a parent whose child recently sustained an injury, you're a coach, you're an athletic trainer, you can really just start the conversation by asking a simple question like, hey, how have you been doing emotionally in the aftermath of this injury? And then listening to see what they tell you. You can also validate and normalize having an emotional response to injury by saying something like, it's really understandable to feel disappointed that you have to miss out on your sport, or, I understand that you might be feeling sad about having an injury like this. And that creates an atmosphere where young athletes feel comfortable to talk about how they've been doing emotionally after these injuries. And that's something that everybody who is supporting kids has the opportunity to foster.